Hi guys, welcome back to my YouTube channel where we always talk about health. My name is Sally, I'm a clinical officer, and in this channel we always talk about health. And please, if you have not subscribed, please subscribe so that you can be part of this family. And today episode I'm going to talk about the difference between a clinical officer and a nurse. And the first thing I'm going to talk about is the qualification. For you to do a clinical medicine and surgery, you must attain at least a mini grade of C plane and above. That is the mini grade KCSE result. You must attain at least C plane and above, C plane in biology, C plane in either Kiswahili or English, and C plane in chemistry, C minus in mathematics or physics. Those are the qualifications for you to study clinical medicine and surgery. And for nurses, to study a diploma in nursing, you must attain at least a mini grade of C plane, C plane in either Kiswahili or English, C plane in biology, C minus in either chemistry, mathematics, or physics. That's the difference. Because for clinical medicine, you must attain at least a C plane in chemistry. But for nurses, you can do a diploma with a C minus in chemistry. That's the difference now. Let's talk about the duration of study. For diploma in clinical medicine, we study for 3 years and 1 year of internship. But for diploma in nursing, they do 3 years and a half. They don't go for internship. That's the difference. For clinical officer, you go for internship for 1 year after studying for 3 years, and for nurses, diploma in nursing, you don't require to go for internship. When you study for 3 years and a half, you are done. Another difference is the marketability. Let's say most of medical courses, the marketability is so good. Let me say this: to get a job in private hospital is easy for clinical officer and for nurses. Marketability for both courses is good. Let me say that. But sometimes nurses, there's a little challenges to get a job, but they do get job. The marketability, I can say, is good. Another difference between a clinical officer and a nurse is the workload. Let's say the workload depends with the facility and the number of staff that you have in a hospital. For example, when you work in a very big hospital or facility, you'll find that you have many staff and the workload is easier. But let me tell you the truth, although it all depends on the facility and the number of staff, for clinical officers, they don't do much work compared to nurses, because for clinical officers, you just crack the patient and write prescription, you do examination, that all. But for nurses, you have to go and give drugs, you have to write cardex, dressing. If it's maternity, you have to do delivery. So what I can say, workload for clinical officer is somehow easier compared to a nurse. Let's say another difference is the salaries. Okay, to get a government job is so hard. It's not easy as a clinical officer and even for a nurse. When you talk about the salaries, for clinical officer, diploma in clinical medicine, when you are employed by a government, you get allowed 65 to 80, and for nurses you get at least 65 also to 70. That's the range, but I'm not that sure. But what I'm sure about is the salaries in private hospital. It depends with the facility. But let me say the truth. For a clinical medicine, most of facilities, they pay 30,000 per month, and sometimes you may find some are paying 35, some are paying 40. That's the average of it. Depends with the facility. The bigger the facility, the higher the salary, but the smaller the facility, the lower the salary. But what I was saying about the nurses, most of nurses who are employed by private sector, they are being paid from 20 to also 40. There are some big hospital paying 40,000 for nurses, but most of people doing nursing, they are being paid 20, 25, 28, 30 to 40. It depends with the facility that you are in. Another difference is the recognition. For nursing is being recognized in worldwide. You can work outside Kenya, you can work in America, you can work in Germany, it's worldwide. For nurses, they have job opportunity outside Kenya, outside Africa, but for clinical medicine, for clinical officers, the recognition is just around East Africa. It's not worldwide. Another difference is level and categories. For clinical medicine or clinical officer, you can start from diploma, you do higher diploma, you do degree, you can do masters, and you can do PhD. But for nurses, you can start with certificate. That's the advantage of doing nursing. You can start with certificate, you do diploma, you can do higher diploma, you can decide to do degree, you can do masters, and you can do PhD. Yeah, that's the difference, because the difference is that a nurse can start with certificate, but for a clinical officer, there is no certificate in clinical medicine, so you go direct to diploma. That's all I have for today, and if you are new to the channel, please subscribe. Bye. Love you.